My name's Dr Stuart Cooney. I'm a clinical psychologist and I've worked at the Edinburgh practice since April of 2025. Formulation is, I guess, it's making sense of people's experiences. It takes into account the reasons for coming along to therapy. That sort of intersection between the assessment and then the beginning of therapy. So really understanding what are the difficulties that you're facing just now, but also taking into account key events that have happened in your life. It takes a broader scope as well, where we then take account of the life experiences that you've had and how they have shaped you, how you relate to yourself, how you relate to other people. There are different approaches to formulation that sit with different types of psychological therapy. Some formulations can be really focused in on specific issues that you may come along with, like anxiety, low mood, or OCD, or trauma, whereas other formulations take that broader perspective, thinking about your life experiences and where you are now. Other formulations also have quite a focus in on relationships. So these are all, I guess, options that will be discussed when you come along for psychological therapy, and it really be informed by, I guess, the types of issues and the goals that you have for therapy. So we would work on that together. The first step would be that initial consultation where we meet, we do an assessment, we get a good understanding of what brings you along and what we want to work on. And often at that time you will be speaking to the therapist and they'll be taking notes and thinking about all this stuff. We would then likely, maybe the next session, move into formulation, and that can then make it a lot more of a collaborative process. Me, rather than sitting there with mine making notes as we talk, we've then got a big bit of paper in front of us that we're both looking at, or it's on the wall and we're working through that, or we're both writing on that. And so it's then it becomes a lot more collaborative and working together. What I think is great about the Edinburgh practice is just the environment you're in. So when you walk in, it just feels nice and calming and nurturing. Because going along to therapy can be difficult and challenging and anxiety provoking. So I think straight off the bat, to walk into a place and be given a warm welcome and that nice environment and a nice place to wait before your appointment really helps settle those understandable nerves and allow you to get the most out of your appointments.